Hello and welcome to the ASPS International Resident Forum podcast. On today's episode, we will be talking about fellowships and observerships. I am Carlos Morales. I am a senior resident at Gea Gonzalez Hospital in Mexico City. And in this episode, we will have an awesome guest, Dr. Phuong Nguyen. He is a professor of surgery, chief of pediatric plastic surgery, and associate vice chair for global surgery at the University of Colorado School of Medicine and Children's Hospital of Colorado. His clinical focus includes the gamut of pediatric surgery and craniofacial surgery with expertise in cleft, craniofacial, facial reanimation, orthodontic surgery, and rhinoplasty. He trained in both general surgery and plastic surgery at NYU and UCLA with a fellowship in pediatric craniofacial surgery at the Hospital for Sick Children in Toronto, Canada. He has previously held faculty appointments at the University of Pennsylvania at CHOP, at the University of Texas Health Science Center at Houston. In addition to his pediatric plastic surgery clinical practice, he has had a long-standing interest in global surgery with over 21 years of experience. This has culminated in developing an NGO, Nguyen Reconstructive International, that is primarily based in Vietnam to deliver not only surgical care but also focuses on long-term partnership with international surgeons to improve education and capacity building. He has been invited to lecture, operate, and help build programs in over 14 countries and 3 continents. With his appointment as ABC of Global Surgery at CU Medicine, he's also focused on bridging the intersection of academic, governmental, and NGO stakeholders to optimize global surgical programmatic development. So, welcome, Dr. Nguyen.
Muchas gracias, Carlos.
So, let's start with your fellowship. I believe that you started doing observerships and before applying to fellowship. So what are your thoughts on observership during plastic surgery residency?
I think that's a good question, and thank you. The first thing is to define what's the difference between observership and fellowship. Uh, the easiest way to define it is observerships are very limited in terms of scope and also length of time. So, for instance, here in Colorado, we offer observerships up to 30 days. That's for students, residents, and also other faculty from around the world. But the restriction is it's really just a hands-off type of observership. So you are welcome to join in the operating room and clinic, but you're not really able to participate with the actual surgery or any type of patient-facing types of activities. A fellowship is different in scope, meaning it really is for training purposes. That tends to be longer, generally speaking, minimum of 6 months, more often 1 year. And that's a dedicated program to teach you skill sets that would really translate to your surgical practice. And it's clearly hands-on, it's more intensive, and also more responsibilities.
So one question is, do you think it's needed to do an observership in order to the faculty to know you better and then apply to a fellowship, or it's not necessary? What are your thoughts on that?
I think if you're an international graduate or resident, I think it's useful to do an observership in order to get a sense of what the program is like, and B, of course, get some exposure to the faculty there. Should you be interested in pursuing a dedicated fellowship, I do not believe it's absolutely necessary, but I think it can be helpful for both the trainee as well as for the faculty to get to know each other a little bit.
Perfect. One of the questions that always arise in the international community, can you explain what are the steps that they must need to apply for fellowship? Do they need a USMLE accreditation, or is there any international fellowship that allow international residents to apply without the USMLE, at least in the US?
It's really going to be a case by case basis depending on the program. So there's a few logistics as far as that's concerned. If you're trying to accept an international graduate, Generally speaking, the program has to decide whether it's going to be ACGME or non-ACGME. And ACGME is our national accreditation system for graduate medical education. If a program is ACGME, there are more restrictions. So that means that person it can be an international graduate. I know for us that also if we do go ACGME, we're able to take people on J1 visas because you're now part of the graduate medical education program of the university. But it also has restrictions in terms of operating independently and being able to do billing and things like that. Every program is different. I know some of our colleagues here in Denver, University of Colorado, have other departments have international fellows, which are a year-long process, and for the most part, those are non-ACGME fellowships. So it's a different pathway to do it. So I think if you're an international graduate, the first thing to do is to see if they accept any international people. That's step one, because most of the time it's going to be a visa issue, and that has to go through the School of Medicine and the dean's office. There are, I know because I've counseled some graduates before looking for additional fellowship opportunities, at least in craniofacial surgery. There are a few destinations worldwide that have really become very prominent in terms of accepting international fellows. But I would say the United States tends not to be one of those places. There's only a select few places or programs in the U.S. that I'm aware of that take international graduates.
Perfect. Doctor, your expertise is in craniofacial surgery. For example, for me, I'm interested in both craniofacial and microsurgery. And when I looked for fellowship positions, there's a web page for microsurgery where they upload the opportunities for fellowships. Do you know any sort of type of website where international residents can look for the criteria that they must join in order to get into a fellowship position, or is it has to be through the International Society of Craniofacial Surgery, or where can we look for that information?
That's a great question. There's no one definitive place, unfortunately, but I think your best first stop is, at least for craniofacial, is the ISCFS, International Society for Craniofacial Surgery website. There has been a call recently to try and collate the various opportunities and fellowships that exist worldwide. I don't think it's completely comprehensive yet, but we're hoping to build towards that because clearly that's a much needed network and information resource for various graduate students and residents.
Perfect. So now moving for the students or the residents, I think here we can make a question at you as a program director on what to expect from an observer and what to expect from a fellow, what they must need in order to complete the 6 month or a year fellowship or the 30-day observership.
Right. So I'll tell you our experience with observers. Again, it's limited to 30 days, and we've had trainees from senior residents. Most recently, we've had senior medical students who are planning to go to plastic surgery, and we've also previously had attending surgeons who are in various stages of their career come spend some time with us. So we try to offer a program that really gives a good overview of the type of clinical work we do, as well as some of the educational components. So that includes everything from spending time in clinic with the various faculty, spending time in the operating room with the various faculty, but also importantly, making it reciprocal, where we are able to learn from our international visitors. So we always ask for a presentation, either clinical or telling us a little bit about their home institution, the types of things that they see there, some of the service gaps or resource gaps, or what they're hoping to learn from being in this exchange. And we also offer educational opportunities. We have a robust ongoing lecture series for our residents, and various various symposiums and various conferences where that are a little more focused clinically. So we try to really incorporate our observers into that, even within the 30 days or less. A fellow is very different. That is someone that would take the responsibility of training, which means it's much more intensive. That's much more in terms of expectation. You're basically working um, to take care of patients, and so I think that's a very different intent, and clearly it's over a longer period of time. As you described before, my fellowship was at the Hospital for Sick Children in Toronto, which has historically taken, very, very many international fellows, over the course of many decades. And I think there's some great advantages of that. It clearly makes a very multicultural community, and is able to spread the knowledge around the world. But there are also some challenges with having so many different people from different experiences, because the North American modality of training is not necessarily the way it is everywhere else. So I think there's some learning curve when it comes to that as well.
Do you need well specifically for craniofacial fellowship that the resident must have any experience, for example, in cleft lip international campaigns or surgery or any other international expertise in order to start a craniofacial fellowship?
Yeah, I think it depends on what your intent of what you want to learn is, because craniofacial encompasses quite a few things, and cleft isn't necessarily craniofacial. So, what is the expectation for a fellow? It's usually someone who is, at least from a North American perspective, someone who has otherwise able to graduate and practice plastic surgery, but needs additional specialized training in a subject. For instance, craniofacial. Having said that, when you take international graduates, it is such a variety of experience and exposure. So even though something is on paper, someone may say I'm a senior person, but when you get down to it, there's very limited exposure to, let's say, intracranial surgery. Then that's a very different level of training and expectation compared to maybe someone who has more experience or exposure. Um, I think that, as my advice for any international person is be very transparent and specific about what your goals are for extra training, what you hope to do with that skill set, what are the opportunities for you, to utilize those skill sets, and what is your experience so far. Because I think as a faculty and as a program director, I would really want to try to maximize that year and that training for that person. So it only makes it better if everyone is as transparent as possible and to communicate what they hope to gain out of it and what the expectations are.
Perfect. Um, what are your thoughts on research during the fellowship year? The fellowship has the time uh, to have a research project and to develop it during that time. To be in part with if there is a research program in the university as well. Do they have time to join, or is it 100% time on the hospital and with clinical duty?
Yeah, it depends how it's structured, but I think most academic institutions do have some component of research built into the fellowship and a certain baseline requirement. And that's going to be variable. Usually, that requirement is not huge. Having said that, I know, for instance, I believe my year was to do one project with ultimate goal of having a paper. I think it really depends on the fellow, their interest, and their experience. It can be anything from having multiple projects and really seeing them to fruition versus just doing the bare minimum. But I think it is essential to have some component of research. In our field and academic plastic surgery, you need to have the research skills, how to be critical when you're reading papers, how to write a paper, how to come up with a hypothesis, how to test those hypotheses. I think it is critical to have some of those skills.
Perfect. So you mentioned the multicultural environment in Canada. What are your thoughts on the future of fellowship in America, where now we see that there's a lot of opportunities during fellowships. We see a web page through the ASPS and through others that they are offering positions that they don't get filled during the year, and they're offering position a last minute position. Do you
Right.
think in the future uh, this international community will grow up at least? I mean, not in the residency, but at least in fellowships. Do you think that the requirements for international residents to apply it will get they will shorten and they will have better access to fellowships?
Um, my hope is that there's going to be more opportunities. I do hope that it continues to trend towards offering more opportunities for international graduates. From a philosophical standpoint, as you know, at least with craniofacial surgery, there is often a mismatch in terms of resources and availabilities. So what I mean by that is, in the United States, for instance, there are hundreds of craniofacial surgeons and in multiple craniofacial centers, whereas in other parts of the world there might be zero access to a craniofacial surgeon. So if I am we are developing, in fact we are initiating our fellowship starting this academic cycle, and we're very excited about it, and the intent is that we can train somebody to really use skill sets that can be useful. And I would say opening up to the international realm really allows us to make maximal impact. Um, that is the hope, but there are some real logistics about living and working in a different country, and that means you have to have the support of your university, and there are some logistics with the visas and things like that, but none of them are insurmountable.
So, as your personal experience, can you tell us how was your experience during fellowship? If it was what you expected, have you done it differently at that time? So we can take some notes for the ones that are applying for a fellowship.
Well, I feel very fortunate. My fellowship year was really the best year of my training. So I trained for 11 years, which is probably too much, but that includes general surgery, 2 years of a postdoctoral research fellowship, 3 years of plastic surgery, and that 1 year pediatric craniofacial. And I feel very fortunate that I was able to train not just to learn the skill set, but also with the people I worked with and the scenario I was at, because it aligned with a lot of the things that I value. So Toronto, and specifically the Hospital for Sick Kids, again, has a very long history of international training. And so that really opened up the network of other people. In my year, there was 5 fellows, 2 for the hard tissue craniofacial and 3 for the soft tissue. Came from everywhere. Came from Colombia, from Israel, from the Middle East, from Canada, from the U.S., and it was great. It was really a reflection of the city itself, which is also very multicultural. So I felt that was such a unique experience compared to if you are solely training amongst people from similar backgrounds. So I will say that was really great. And on top of that, you were learning from people who were faculty were phenomenal, very very knowledgeable, very experienced, very academic. I mean, very well published. And so I think they were great role models as well. And I still count on them as um, not as role models, but also colleagues and friends and people I still talk to this day.
Do you think it enhance the global perspective within surgery?
Absolutely. Yeah, I think and this is more of just a general philosophy. It's important to learn about the things you don't know and to learn from each other. One of my great joys is being able to travel and making friendships with various people around the world, specifically in plastic surgery. We're learning from each other, and it's really phenomenal. Like tricks, big and small, right? So not necessarily one way to do things. And I've picked up a lot of little tips and tricks over the years from all sorts of different scenarios from people who've just figured out ways to do things in a way that either is better or makes more sense. And I think that's really the spirit of collaboration and the spirit of learning from each other.
That's That's perfect. So before we finish, do you want us to talk about specifically your fellowship in Colorado? If you want to invite international community to apply or to have some information about the program, is it a running program now or how it works in Colorado?
I'm happy to talk about it, and I will tell you the my the, my first caveat is it is a work in progress. So, um, first, I invite the international community that anyone who has any interest in visiting us here at the University of Colorado at the Children's Hospital of Colorado, you are always welcome. And we are able to, whether it be your interest in children's pediatric type of plastic surgery or adult, we can arrange for that. We have a very robust international process for welcoming visitors as an observer. Um, and my role as the associate for vice chair for global surgery, this I was recruited here 2 years ago, and part of that recruitment was to develop a true global surgery program. And so we've really been building upon that, building relationships with various hospitals, signing MOUs so we can have bidirectional exchanges, including, like I said, from students, trainees to faculty. So we currently have relationships with hospitals in Vietnam, in Brazil, and in Rwanda, and that continues to grow.
And
Uh,
soon in Mexico.
and soon in Mexico, absolutely, just a matter of time. It's already in my head. It's already done. Um, and as far as fellowship goes, we have started a craniofacial fellowship, and we have had to go under the guidelines of the American Society of Craniofacial Surgery. So we've put together, clearly what the program entails, what types of cases we do, and all that's going to be accessible through the ASCFS webpage. In our first iteration, it's only going to be U.S. graduates, and that was very intentional because we needed to establish the program first before we could open it up to international graduates. Having said that, there are mechanisms to do it. My ultimate goal is to mirror what we have done over in the Department of Neurosurgery, also here, is they have both a domestic as well as an international graduate for their fellows. So I think at steady state, I'm hoping to be able to do that within the next 1 to 2 years.
Perfect. And for the American residents, they have to do it through the SF match, right?
That's correct. So that goes to the SF match. So we are, like I said, we're very excited. It's a brand new program. I believe we have a lot to offer. Here we have a total of 6 faculty in the pediatric side. So the fellow will certainly learn everything from intracranial, cleft, facial reanimation, all the fun stuff. Um, and we're hope, and we also have a very busy pediatric hand surgeon and a craniofacial orthodontist. So you really get a comprehensive education. Um, Incidentally, 2 of my colleagues here in partners here at Colorado are also trained from the Hospital for Sick Kids. So we always jokingly say that we're Sick Kids Mountain West.
Perfect. So as a close of remarks, I believe that we can summarize that for observers and for fellows, it is important that they look for the programs, they keep on researching opportunities, and have this attitude towards looking the right place to train, right, and keep on searching for these type of opportunities because sometimes they don't show up to everyone, right?
That's absolutely true. And like, keep your eyes peeled. I wish there was one central place that you could always look for. I think the ASCFS and ISCFS websites are one good place to start for craniofacial. Also, at least for North America, the ACAPS website, which is ACEPS, that's the Academic Council for Educators from Plastic Surgery, often posts job listings. And as you mentioned before, sometimes these are unfilled fellowships that might be open for a wider array of applicants. So those are good places to look if you are interested. I know they have social media handles, and those often get updated much more often than the websites. So, for instance, the ACAPS often posts new job postings as they come up, and that tends to be more frequent. So, um, keep your eyes peeled, and also use your networks. And if you don't have a network, then reach out. Reach out. It never hurts to cold email somebody if you admire their work for whatever reason, whether it be you knew about their research or you've heard about some of their the programs. Yeah, I think in general as a community we try to help each other out. We try to help out people. So it may or may not lead anywhere, but it never hurts. So I would encourage you, if you have very specific goals, just reach out to people, and you never know where it's going to lead.
Great. So, Dr. Nguyen, thank you so much for joining us on today's podcast. It was a great honor. I hope you can join us in the future. And a special thank you to our listeners. It is important that we bring light to this topic, fellowships and observership. And thanks again for joining us on the International Resident Forum podcast. Be on the lookout for the next episode. If you're a resident or fellow in plastic surgery, we encourage you to join the ASPS International Resident Forum. It is a place where you can connect with peers across continents, access educational resources, and be part of a global community committed to professional growth. Thanks again for tuning in to the ASPS International Resident Forum podcast, and be sure to catch out our next episode. See you then, and thank you.
All right, thanks so much.